And a very good afternoon, everyone. Welcome to Issues and Attitudes. My name is Jeff Owens, General Manager at WEIU. My co-host is Michelle Bravo.
Hello.
Hello, Michelle. And our guest today, Kim Uphoff.
Hello.
CEO of Sarah Bush Lincoln.
Hello.
Health System. So we appreciate you all coming in and, or you coming in and talking today to us here at WEIU. I guess, Michelle, I want to start off, or Michelle, Kim, I want to start off with, as I messed that one up there, hit the wrong button. I want to start off by talking a little bit about when you knew you were going to become the CEO and go forward after that. Kind of like take us through that process.
Sure. Well, we knew that Jerry Esker was retiring. He had been with the organization for over 35 years and had been CEO for the last 6 years. And he and I had worked very closely together over that time. And so it was nice to plan for that transition. And when he announced his retirement, I was positioned well to be his successor. And so I talked with the board, interviewed with them, went through a series of interviews, and they engaged a national recruitment firm as well. And so there was some consideration to go on a national search and also a local search. And once they completed all of those interviews, I was selected as the next president.
How excited were you?
I was very excited.
That's awesome.
It was great. Yeah, I mean, it's not anything, in my life that I thought that I would ever do. But over the course of my career, I just had the opportunity to do different things and be in the right position at the right time, and so it felt good.
That's awesome.
So how did you start off? Like, what was your first, job before you got to where you are now?
Oh gosh, well, like my very, very first job, you don't mean my very first job, because
No,
that's
yeah.
fun. I mean, I worked at Ponderosa with Jeff's wife, actually, 35 years ago. So after college, I was hired by Lincoln Land Visiting Nurses to run their marketing and communications department, and that's what my degree is actually in.
Okay, that's similar to me.
Yeah. So I did.
Take us through then. I mean,
Okay, sure.
all the twists and turns.
All the twists and turns in my career. So I went to school at the University of Illinois and graduated in the College of Communications with a degree in advertising. And so I didn't choose healthcare as my field originally. I chose communications and advertising and marketing. And then I happened to land a healthcare organization who needed an advertiser and communications director. And so I was hired by Lincoln Land Visiting Nurses, which was the largest downstate Illinois home care agency that we had at the time. And I worked there for 5 years, and it was great. It was a wonderful experience. We opened new branch offices. I was able to advertise for them, do their brochures, those kinds of things, and learn about healthcare. And I became interested in healthcare over those 5 years. So I decided to further my education there, and I went back to school and got a master's in healthcare administration while I was working for Lincoln Land Visiting Nurses. And then after those 5 years, Lincoln Land Visiting Nurses was acquired by Sarah Bush Lincoln, and I joined Sarah Bush Lincoln and became their director of planning and business development, and really then started my path down strategic development, business development in the healthcare field.
Wow. And so how long have you actually been at the Sarah Bush campus then?
I've been at Sarah Bush for 24 years.
24 years.
And again, joined there as the Director of Planning and Business Development, and then in 2010 was promoted and joined the administrative team as Vice President of Development, and actually played a role in fundraising at that time, and was over the foundation and did that for a few years, and then was moved into the VP of Operations role, and have been doing that for the last 10 years or so.
Before we get into some other details, can you tell us what you feel is Sarah Bush's commitment to the community and talk about what they do for the community?
Yeah, that is, I think, what differentiates us from other healthcare organizations in downstate Illinois, and it's something that I am most proud of Sarah Bush Lincoln, is our commitment to the community. And so our mission is to provide exceptional care for all and create healthy communities. And I always tell our new employees the create healthy communities is what makes us special, that we partner and join with other not-for-profit organizations so that we can create a healthy community in the broadest sense. And we use our profits and income to reinvest in the community and support it that way.
Yeah, that was really, I don't know what I was going to say. I just blanked.
Did I ask your question?
No, I was going to say how, have you had some difficulties, as a woman, because I don't know, if there's many CEOs that have been before you,
Yeah, that's a great question. No, I am the first female CEO at Sarah Bush Lincoln, and that was talked about a lot at the time.
Yeah.
And, it's something that I haven't thought a lot about, really. Mm-hmm. I've always just been in had the thought that it's just the best person for the role, regardless of their gender or background. And so I don't really pay a lot of attention to the gender issue, but but others do, and I am the first female, in this position.
What I think is weird about that is I didn't even think about that when I knew you were coming in. But you, as a younger person, are you more aware of things like that, Michelle? I mean,
I feel like you notice it more just because, like, it gets to a certain point where it's like the intersectionality of like, I'm a female, I'm also like, I'm not a white female, so it's like you notice things like more differently than like a male who you would have never thought of asking that question.
That's interesting. I mean, it's some of the things that you find out.
It is, and I'll tell you, when it was announced, I was bombarded with emails and texts from the younger generation about that very issue. So I think you're spot
it's
on
good
with
that you're paying attention, for sure, because I guess I didn't think about it as much because maybe I don't, maybe I should, or maybe I don't know. I don't know if it's good or bad.
Yeah.
It's just one of those weird. You'd like to talk about that more, maybe. The other thing I noticed about Cerberus is you always have stuff going on out there on the campus between Matthew and Charleston. So how do you, as a CEO, kind of operate knowing that there's all these different construction projects or just remodeling, and how do you keep it all together?
Well, I have a great team, who organizes and manages all of that. So we have a 10-member administrative team, and they're all responsible for different parts of the health system. And so there is a lot going on, but each one of our vice presidents is over a division of the health system, and they manage that. And then I meet with them routinely, and each week, we have a group meeting where everyone will provide a status report and we'll talk about the progress that's being made. Construction is a big part. Growth is a big part. So I would say that consumes the most of my time would be the projects related to new services or new facilities.
And what's going on? Can you give us an update on what's happening out there?
Absolutely. We have two very large construction projects going on right now. One is on the north side of the campus, so if you've been out there to see that, we are adding on 65,000 square feet to the north side of the hospital, and what that will give us is 20 additional inpatient beds, which is so incredibly and critically important to us right now. We are full almost every day with patients in-house, and so we need additional beds. We'll be able to expand our CCU unit and our step-down unit, which is an adjacent unit providing higher level of care for those patients. And what that means for the community, Jeff, is that people will no longer need to be transferred for as many things as they once were transferred for to a tertiary care center. We're able to keep patients at Sarah Bush much longer than we ever have before.
And I guess the big news last week came from the state, but you talk a little bit about the mask mandate and where we are. I know you're happy that you don't have to wear a mask every day.
Oh, I think our employees are thrilled with the opportunity to take those masks off and smile again at one another and to all of our patients. And so thrilled when the governor of Illinois did not extend the requirement to wear masks. And so now the state of Illinois matches the CDC federal requirements. Those changed a few weeks ago, but our state had not made that change yet. So we were waiting on that governor's executive order. And so we are now aligned with the federal government, and so the state of Illinois is no longer required to wear masks in healthcare settings.
But don't panic, they're available if you want to wear them.
They are. So masks are available at all entrances, and if someone wants to wear a mask, we encourage them to do so, especially if they're having any kind of respiratory systems or feel that they're infectious, or if they're immunocompromised. I mean, we want people to be safe. Safety is the most important thing there, and so masks are available but no longer required.
Okay. COVID is still not completely 100% gone from the area. So I guess, is there numbers about how are you tracking the numbers of COVID patients, and are you seeing the decline like we are seeing nationally or not?
We are. Every morning at 8:30 we have a safety meeting and we report our COVID statistics. And so I can tell you today we have 4 people in-house that have COVID. Most of those patients were incidental findings. And so most people being admitted now are for other reasons, but they just may have COVID as well. So back last fall, people were acutely ill with COVID. As you remember, we had over 40 people at any given time in our hospital with COVID and on ventilators. And we had, several people lost their lives to COVID. And so it was a very serious time for us. Right now, the current state is much less serious. People are not nearly as sick with COVID, and people are being vaccinated and taking precautions. So I think that's good. But the incidence level right now is very, very low. And so we're pleased with that.
Michelle, you have something?
So I know that, obviously, people don't really want to talk about COVID anymore. But when you guys had the outside testing center, how did you guys like come up with a plan to have that built there? Because I know it was just kind of like a little shed that was just like.
There was, yes. So, you know, hospitals are set up with emergency management systems, and so we plan for disasters every day, but that was really obviously the only pandemic that Sarah Bush Lincoln has lived through. And so we put all of our resources in place and partnered with other hospitals and other organizations to learn best practices very quickly. And so we identified that we needed to test hundreds of people each day, and we needed to do that in a safe manner. So we set up a portable testing system outside of Sarah Bush Lincoln to do a drive-through testing. We were, I will say, I believe we were very nimble, very adaptable, very innovative during that time, which helped us get through
The
it.
organization was amazing how fast it happened, I thought.
Thank you. It's really all about the people. I have never been so proud of our workforce during that time for everything that they endured and how quickly they adjusted and changed to make it happen.
You've only been the CEO for a few months now. Besides COVID, is there been any other gigantic challenge that you've had to face or overcome, or?
I would say recruitment and retention of employees, and that's not just specific to healthcare, but that's, in almost any industry at this point in time. But recruiting talent is incredibly difficult at this point in time. And so a lot of effort is being placed on our workforce and doing things that make it attractive for people who are in healthcare that want to work in.
Can you give an example of, like, if you need a new surgical doctor, or you need something that's really a high-paying, high-end job, where do you go find that person at, or how do you go through that process?
So for our medical staff, we have a full-time recruiter at Sarah Bush Lincoln that recruits our medical staff, and we work with other national firms to help identify those individuals. But I'll tell you, Jeff, once we get a physician, or a medical student, rather, who's becoming a physician, once we get those individuals to Sarah Bush Lincoln and on our campus and to Central Illinois, we really have pretty good luck at recruiting them to our organization. We market the area. We are in a safe community. We have a beautiful community that we like to tout. And then Sarah Bush Lincoln has beautiful facilities compared to some of the other hospitals. And so if we can get them to our campus, we do well. But, we are competing with New York and California and Chicago and Florida, some high, places that are highly attractive to want to live and work.
Is there misconceptions about Sarah Bush that you would like to, to stop, to put an end to today, or?
Gosh, I can't really think of anything other than just my time there. When I joined 24 years ago, we only had 1,300 employees. And, we grew up here. You and I grew up in this community. And so I remember being a kid, it was just such a small hospital. And I think long, long ago, 30, 35 years ago, people might have referred to Sarah Bush Lincoln as a Band-Aid station. We are the farthest thing from that today. Not only are we a community hospital, but we are a regional health center covering 10 counties, and we now employ over 3,000 people. So we are certainly a growing healthcare entity providing care now to a region, not just a community.
And how many different satellite operations do you have? I know there's tons of them, and you obviously bought the Vandalia Hospital as well.
Right. So we now are a 2-hospital system, one here in Mattoon and one in Vandalia, called Fayette County Hospital. We have been operating that hospital for the last 2 years and became owners in July. And then in addition to those 2 hospitals, we have 50 clinics.
Okay.
50 in those 10 counties. And so access to care is really important. So we like to have as many access points as we can to provide that care and then bring them back to the hospitals when needed.
Okay.
Yep.
Michelle?
You guys are the #1 cancer center, right? Is that what it is? I don't know if that's accurate or not.
So we have one of the largest cancer centers in this region for sure. And we partner with other cancer centers as well. We are in a BJC collaborative with Barnes Jewish Hospital and do some work with them as well through some clinical rotations. Dr. Shakir is our oncologist there, and he is world renowned. He truly is. And he has connections really all over the nation in terms of subspecialty care if our patients need that. And he has connections in Chicago and other locations to help provide that care. But he can provide most of the cancer care right here in Mattoon.
I want to go back to the clinics again. There's 50 of them now that you've just been named recently the CEO. Is your goal to get out to all 50 and so that they can put it, so they know that, I don't know if the word is that they know you care, but they know that a little face to the name and all that stuff? Will
Absolutely.
you be doing some traveling like that?
Absolutely. I think rounding to all of our locations and employees are so very, very important. And the good news is I'm not new to the system or the area. I've been there for 24 years, so most employees already have a familiarity with me. but it's really important to continue those relationships and visit with our employees. We do that. We do something called a daily charge every day in all of our departments and all of our clinics, and so it's an opportunity for the same message to be shared across our entire workforce every single day. And when all of those departments or clinics meet to hear the daily charge, it's a great opportunity.
And it went off right there.
It's a great opportunity for myself and other leaders to go and round with the employees during that time.
What do employees ask when you're in those charts? Do they ask questions?
Oh, they do. They do.
Can you give us insight?
I think we have a wonderful environment where I think our employees do feel very safe, and it's just very friendly. So I do get asked questions a lot. I don't know what the questions would. A lot about construction, new projects, new services. They may ask about retention and recruitment strategies. They know workforce is a big deal right now, and everyone's feeling it because we need more employees. And so a lot of questions probably around recruitment and retention.
You said you had 3,000 employees. How many do you really need? I mean, when you say there's so many opportunities for work out there, so
Sure.
are you looking for another 100 people, 200 people, or
I
what?
would say right between 100 to 200 would be our vacancy list right now. And we look at that each week as well as we move forward to try and fill those roles.
Do you consider yourself a goal setter? I mean, as you work there?
I am. I think we all need to be successful.
Yeah.
And so we have a very formal strategic process and a very formal goal setting structure, so that everyone knows what the organization's goals are, what their individual goals are, and how they relate back to those organizational goals.
And then, what is your leadership style in those meetings and in those settings? Are you a listener? Are you proactive? Combination? Or talk about Kim Uphoff's,
My leadership style.
Yeah.
It's really to build a team and to serve the team and to let the experts do their job. And so I like to surround myself with strong leaders who rely on their team to get the job done and develop great teamwork.
Okay, Jill.
So, what does your day look like? Like just a basic, like from the start
Sure.
to finish?
So every day is different. I think that is what makes my job interesting and unique and exciting. So I can't think of a day that has repeated itself. My day could start anywhere from 6:45 in the morning. If there are some medical staff meetings or board meetings, those typically will happen first thing in the morning. And then every day at 8:30 we have a safety meeting. So all leaders come together to talk about any safety issues or information that they need to share, and then that's followed by a daily charge. So again, that message that we want all employees to hear that day. If we have any special announcements that we need to share, we do that at that time. And then I meet with my staff throughout the day. And then on occasion, there will be an event or board meeting in the evening to attend as well. So Sarah Bush is so active in the community, and we are the face of Sarah Bush Lincoln, so we try to participate in as many evening activities that we need to.
What about how the fall events? Can you talk some things that are coming up? I know we have some people from Sarah Bush coming in later on, I think, in November to go through details, but what do you know that's happening for sure?
For some of the events, I know that we will have the Christmas lights out at our facility, and so excited to invite the public out to look at the lights, and that is, I think, on November the 17th. We're having a drive-through open house so that people can come out and take a look at the lights. But all kinds of events are going on, and so I'll let them share those types of things. We have the Holiday Festival that's coming up in November, and that's a wonderful fundraiser that supports our hospice house, which I've not talked about. That's the second construction project that's going on the north side of our campus. Is we're building a hospice house, which will be the only hospice house in downstate Illinois.
And how many people will that serve? And take us through the details.
So we'll have 8 hospice suites there, and so we can serve 8 families at a time. The closest hospice house is in Joliet or in St. Louis, and so we're excited to be able to provide those types of services for this region.
And then the other thing that's happened nationwide is there's a nursing shortage.
There is.
You guys are hitting that. So how do we solve that problem? I mean, everybody says because you just can't hire people just to hire people, but how do we solve it?
So I think we start with the high schools and the younger generation and teach them about healthcare and get them excited about wanting to be a nurse or going into the healthcare field. I love our occupational health class because we partner with health occupations and the schools so that the kids can come in early during high school and learn what it would be to be a nurse or any other occupation within the hospital, and really get those kids interested early and recruit them to that type of career.
This is a tough question. I just thought about it. So social media and
Yes.
nursing, though, because and it's not that nurses they'll post, I just got off an 18-hour shift,
Yeah.
and I saved 4 bodies, or and I did all this wonderful work. But then again, that also has that adverse effect. I don't want to work 18-hour shifts, and then you're telling me it's the greatest job ever. So.
Right.
How do you
Balance
kind
that
of combine that into something?
So it's an incredibly rewarding career, right? You work with people and you save lives, and so there's really nothing better. It's hard work, but I think the more nurses, the less shifts we'll have to work. So we need to do a great job of recruitment and retention, and we need to be really creative about how we set up shifts. So you mentioned, like a 12-hour shift or something longer. Some nurses and individuals may prefer to do longer shifts and only work 3 days, and then have several days off in a row. And so we're really trying to think out of the box and be creative with schedules to meet what the new generation would like.
Okay, good. That's a good answer. So,
Yeah.
Yeah, my sister's doing that. So, like, I kind of understand where it's like people would prefer to work like an 18-hour shift for like 2-3 days in a row and then not work the next 3 days, because that's kind of like decent.
the fireman idea,
yeah.
right?
They do. They
Yeah.
do. And so, I think that's new in terms of nursing shifts, where it used to just be 3 shifts and they were standard, but everyone is being creative these days
Yeah.
so that we can meet the demand.
You've mentioned safety a lot. I guess from the outside point of view, when you say safety, are you talking about campus safety or inside there? What do you mean by that?
Safety to what?
Yeah.
Safety on all levels.
Okay.
And so we just talk about obviously quality in terms of clinical care to make sure that we are safe. We also talk about security. We do have 2 full-time security guards, and we talk about workplace safety. And so we just want to make sure that we have a safe environment there for everyone involved. And so you just never know what issues may come up. But if there's an issue that needs to be addressed, we just need to make sure it's communicated and everybody knows.
The ambulance issue in Matthew and Charleston has kind of been, different people, different companies have come and gone. Mitchell Jordan has stepped up. What's your kind of view on ambulance services in Coles County?
So Sarah Bush Lincoln, we don't own an ambulance service, so that's not a service we provide, but we do partner with private entities and local governments to provide those services. What we have done is we have contract with a local ambulance service to provide our transfers, so that if you are in our emergency room and you need to be transferred to a higher level of care, we have contracted with an ambulance service to make sure that transfer occurs. It was becoming increasingly more difficult for the ambulance services in the area who are responding to other emergencies to be on standby to meet our transfer need. So we have done that at Sarah Bush Lincoln to fulfill our requirement to make sure that we have a reliable and safe transfer for patients from our ED to other institutions. In terms of emergency care, we work with all ambulance services, whether that is a private entity or a government entity, and all of those emergency services and ambulance services bring those patients to Sarah Bush when needed.
What have you learned from being just the CEO this first few months? What is the new stuff that you've learned?
Oh, gosh. Communication is important. Relationships are important. I think those are things I already knew, but things that I do spend all of my time on. So it's really important that we have a strong and positive relationship with the medical staff, with our 3,000-person workforce, and with the community that we serve. And so I really feel like the majority of my time is speaking with those groups of individuals to make sure that we're communicating well and just sharing the good things that we're doing at Sarah Bush Lincoln.
Mary, Michelle?
So how long have you actually been like CEO? Because he keeps saying months, but I'm like, how long?
August 1st.
Yeah, she's
okay,
brand new. She's been at Sarah Bush for a while. We won't say how many years, right?
24. I've been there for 24.
What is the Kim Uphoff way to handle a problem if it arises? It doesn't have to be even an executive session. It can be with a nurse who's unhappy or a patient. I mean, what do you do?
First I listen. I think it's really important to pull together the right people who can solve the problem and have all of those people around the table and listen to them and then have them talk to one another and just facilitate that conversation so that we can collaborate together and reach a consensus.
You said you had 10 people on your executive team. Is that counting you or not counting you?
I think that's counting me.
Okay.
Yes.
So what if it's 5-5? Does your vote sway? I mean, if it's an issue?
You know, in all my years there, and I've been a part of that team for the last 12 years, we have never once discussed
never had
an issue
5-5?
where it was a 5-5.
Wow.
Never.
You know, I
No.
just jinxed you, right?
Yeah.
You did. Although, if you go with my leadership style and you bring everybody around the table and reach consensus, you should all be on the same page eventually.
Which says that's a lot that there's not been a 5-5.
Yeah.
So that's interesting that you say that. Did I forget anything you want to talk about today before we get to the the world famous
Fun stuff?
the random 8? So Michelle, you have any final questions for Kim?
No, I don't think so.
All right. Anything you want to get out there?
No, I'm good. Thank
All
you.
right, so I came up with these today, and I was, we always try to tie into the season and the occupation. So some, Michelle, you can answer, and some you won't be able to. But favorite medical show or movie? Is there one that you love to watch?
You know, I don't watch a lot of that today because I think it's just full of drama and it kind of stresses me out. And, we have enough of that during daytime. But MASH would be my favorite medical movie from all time, back in the day.
Okay, well, when you were talking about like safety, I just kept thinking of Grey's Anatomy. 'Cause I'm like, they always have something crazy going on in their hospitals, like whether it's like some person like doing something crazy or a bomb
Yes,
going off.
my-
And I've never watched that show ever.
My children love Grey's Anatomy.
Oh, really?
That's a top show for them.
been
So
on TV for so long.
it's
Yeah,
a
just-
generational thing. Yeah, it's been on for many years.
There you go. Weird and odd question, so I apologize in advance. Do you ever go, hey, I want to watch surgeries? Do you get the opportunity to watch surgeries?
Okay, well, that is a great question, Jeff. I'm going to get the opportunity to
Okay.
watch a surgery. And our former CEO, he did that the last week before he left. He partnered with some of our surgeons and watched some of their surgeries as well.
Would you
so
do
it
that?
is possible.
Would you watch somebody's surgery?
Yeah, if they were like okay with it, like yeah.
Oh, sure. Of course. Permission must be given.
Yeah.
But
Is that, can you imagine, before we go in there, the CEO wants to watch the surgery.
Yeah, like open heart surgery would be cool.
All right, your favorite hospital cafeteria food, and you have to answer this one. All right, so is there your go-to sandwich in the Sarah Bush Hospital cafeteria?
It's a go-to soup. So, and I like the soup so much, I order it so that I can have it at Christmas, too, for family gatherings. And it's a Southwest adobe soup, and I think it's fantastic.
Is it like catered or is they just make it in house?
No, we partner with GFS, and most of our food products come from GFS.
Michelle, she knows the question next. All right, you're the CEO of Sarah Bush. When you have to go see a doctor, do you have to wait?
I am treated just like everybody else in
And
the
she-
organization.
All right.
I would like to think no one has to wait, but I get no preferential treatment.
Okay. So, are you gonna dress up for Halloween?
You know what, we are. Yes, we have a Halloween party to go to next weekend.
What are you gonna be? Are you?
Bill and I are going to dress up as the Incredibles.
We asked this last week for you.
Yeah, I got my costume in last night. It's not working
What
out.
are you
That
gonna
wig
be?
was really bad.
What was it gonna be?
My friend was gonna dress up as Scream. Well, she's still gonna dress up as Scream. But the Drew Barrymore character that she's like the first one in the movie that gets killed.
Yeah.
Scream. Mhm.
Yeah, I was gonna be her, but that wig was crazy. So I'm just probably not gonna do the wig.
Last year we were Bob Ross, and I was a painting, and so that was kind of fun too.
Worst Halloween candy?
Either black licorice or those really hard popcorn balls that you can't eat, like you break a tooth on.
I think that like Tootsie Rolls are the nastiest thing.
Really?
Yeah, those are so disgusting. I don't know why people eat those.
All right, in 10 seconds, is there a place you go on campus to get away from all the think?
The place I go at Sarah Bush campus to get away?
Yeah.
No.
Okay. I just wonder if there's a place that you.
I'm trying to think. Gosh.
We're out of time. Thanks so much for coming in, Kim.
Yes.
Best of luck and congrats on the job.
Thank you.
Everybody have a great day.